Hi, I'm Dr. Jeffrey Johnson, double board certified facial plastic surgeon here at ImageLift. I've always been very intrigued by the human mind, and I actually pursued medicine initially to become a psychiatrist. I was fortunate enough during my medical training to have several mission trips, one to Uganda, and then eventually one to Vietnam, where I was able to participate in some cleft lip and palate surgery. I realized through this time that I was able to see how surgical procedures could actually help people feel better about themselves rather than giving medications. And once I saw that, and I realized that I was gaining a skill that I could use in my community to help people as well as around the world, I was hooked. I was born and raised in Indiana. I went to Indiana University for undergraduate. I studied neuroscience, psychology, Spanish, and I went to medical school as well in Indiana before moving to Texas for my ENT training, or otolaryngology. I then pursued a facial plastic surgery fellowship back at my alma mater in Indianapolis with my mentor who inspired me to go into facial plastic surgery. From there, I moved down to Florida to start my own practice. I graduated medical school in 2015 and moved to Florida in 2021, where I've been practicing facial plastic and reconstructive surgery. I have a hybrid practice where I work part-time in academic medicine doing reconstructive surgery. And 2 days a week, I'm here at ImageLift in the Villages, so I do about 4 facelifts every week. So I don't think as humans we were really designed or evolved to look at ourselves as much as we do. We spend a lot of time now versus in our past staring in the mirror, taking selfies. We're very critical of ourselves. And so I love that I get to be the one to help you change what you see in the mirror and to help you focus on that less and focus on the rest of your life more. I have a very broad background doing quite a bit of complex reconstructive surgery as well as cosmetic surgery. And I think being able to balance these two sides helps me really appreciate the facial anatomy better and make me a safer facelift surgeon. The most common and most popular procedure I do is the deep lift, which is a comprehensive facelift and neck lift. My favorite treatment is a facelift with CO2 laser resurfacing at the same time. Lots of people have sagging, which we lift, as well as sun damage, especially here in Florida, which we polish with the CO2 laser. You need a consultation. Figuring out the best procedure or procedures for you is a two-way street. I might suggest some procedures I think would look good, but I really want to know what bothers you. There's a reason you called ImageLift, there's a reason you came in. It's because something's bothering you and you want to feel better about that. So I'm a pretty straight shooter. I like to start there. Tell me what bothers with you and we'll work from there. Yes, that is our guarantee here at ImageLift, that you will look natural. We don't like over-pulled, overdone look. We want you to be comfortable with who you are, look like who you used to look like. No, hiding the scars is my job. With carefully placed incisions along anatomic boundaries, along hairlines, we can hide most of the scars, and by 3 months, they're really imperceptible. The best results come from having a very in-depth consult with me to look at your face, feel your face, see what the structures are like, and combination treatment. You know, when we have sagging, we need to lift that. When we have loss of volume, we can fill that. When we have issues with the skin quality, we can resurface that with CO2 laser. One of my favorite patients is actually one of our weight loss patients, which is becoming more and more common now with GLP-1s like Ozempic and Zepbound. We're having patients that are losing quite a bit of weight, now having a lot of excess skin, a lot of sagging they didn't have. They feel like they don't look like themselves anymore. They want that youthful look, youthful look comes when we have more fat in the face. And so when you take these drugs, you lose fat all over the body in equal distribution. You don't just lose belly fat, you lose face fat as well. And so she was very confident in her overall weight. For the first time, had lost 200 pounds. And she really wanted her face to reflect how she felt. And so we did a deep lift, upper blepharoplasty, brow lift, some facial fillers on her, and she was just thrilled finally with the results, that she could feel confident in her weight and confident with the way she looked. I like to stay busy when I'm not at work. I go to the gym every day. I play rugby for the Gainesville Hogs. I play pickleball with some of my friends. I love to bake. I actually brought some blueberry jamboree for the girls in the office today, so I try to balance the desserts with the healthy. I like to play with my dog, go on bike rides. At ImageLift, we put the patients first. That's our mission. We want to make sure everyone has a good outcome and they're happy with the results, and we do it safely. This is one of very few centers in the country who does all of their surgery under local anesthesia, saving you the risks of general anesthesia, intubation, IVs, all those issues. We make it the safest possible. I'm excited for your consult and look forward to meeting you.